Hi, I'm Nurse Marcia. Welcome to part 1 of my NCLEX-RN prep series on pediatric respiratory conditions, a favorite topic for the exam. Today, we'll tackle 20 advanced NGN questions on high-yield and previously asked topics like asthma, RSV, and croup. I'll break down each question with detailed rationales to help boost your confidence. Let's get started. Question 1. Match the asthma-related condition with the correct description and treatment. Condition: A. Acute asthma exacerbation. B. Exercise-induced asthma. C. Poorly controlled asthma. D. Allergic asthma triggered. Description: Nighttime symptoms more than 2 times a week. Wheezing after physical activity. Severe shortness of breath, chest tightness. Environmental allergens. Treatment: tap-up therapy. LABA before exercise. SABA inhaler. Antihistamines or ICS. Answer: Condition. Description: Treatment: A. Severe shortness of breath, chest tightness, and SABA inhaler. B. Wheezing after physical activity and LABA before exercise. C. Nighttime symptoms 2x/week and step-up therapy. D. Triggered by environmental allergens and antihistamines or ICS. Rationale: Acute asthma exacerbation, managed with a SABA, short-acting beta agonist like albuterol to relieve bronchoconstriction quickly. Exercise-induced asthma, prevented with a LABA, long-acting beta agonist before physical activity to avoid bronchospasms. Poorly controlled asthma, requires step-up therapy such as increasing the dose of inhaled corticosteroids or adding another controller medication. Allergic asthma, managed with antihistamines or inhaled corticosteroids ICS to reduce inflammation caused by allergens. Question 2. During an asthma attack, which pathophysiological changes occur in the airways, further complicating breathing? A. Airway constriction and decreased mucus production. B. Airway inflammation and increased mucus production. C. Bronchial dilation and reduced airway resistance. D. Airway narrowing and reduced blood flow to the lungs. Answer B. Rationale: Correct answer B. Asthma attacks are characterized by airway inflammation and increased mucus production, which lead to bronchial hyperresponsiveness and obstruction. Incorrect options: A. Asthma involves increased mucus production, not decreased. C. Bronchial dilation occurs with bronchodilator treatment, not during an attack. D. Airway narrowing is correct, but reduced blood flow to the lungs is not a primary feature of asthma. 3. Which findings indicate a pediatric patient is experiencing an asthma exacerbation? A. Wheezing. B. Inspiratory stridor. C. Chest retractions. D. Peak flow at 95% of baseline. Prolonged expiratory phase. Answer A. CE. Rationale: Wheezing. A. This is a hallmark symptom of airway obstruction during an asthma attack. Chest retractions. C. Retractions indicate the use of accessory muscles to breathe, a sign of respiratory distress. Prolonged expiratory phase. E. Asthma is an obstructive airway disease, meaning expiration is especially affected. Incorrect options: Inspiratory stridor. B. Suggests upper airway obstruction often seen in croup, not asthma. The peak flow at 95% of baseline. D. Indicates good asthma control, not an exacerbation. 4. True or false: Croup commonly presents with a barking cough and low-grade fever. Epiglottitis is a medical emergency requiring immediate airway management. Antibiotics are the first-line treatment for viral croup. Answer true, true, false. Rationale: Croup. True croup is a viral illness that causes inflammation of the larynx, trachea, and bronchi, leading to a characteristic seal-like barking cough and low-grade fever. Epiglottitis. True epiglottitis is a bacterial infection that can cause life-threatening airway obstruction. Immediate airway management, such as intubation or tracheostomy, may be required. Antibiotics for croup. False croup is usually viral, so antibiotics are not effective. Instead, corticosteroids, e.g. dexamethasone and nebulized epinephrine, are the main treatments. 5. Match the condition to the most appropriate first intervention. Condition: Croup. Epiglottitis. Foreign body aspiration. Bronchiolitis. Intervention. A. Provide supportive care, hydration, suctioning. B. Keep the child calm and avoid invasive procedures. C. Perform back blows and chest thrusts for infants. D. Administer racemic epinephrine. Answer: Croup. D. Epiglottitis. B. Foreign body aspiration. C. Bronchiolitis. Rationale: Croup. D. Racemic epinephrine reduces airway swelling and improves breathing in moderate to severe cases. Epiglottitis. B. Avoiding agitation is critical to prevent complete airway obstruction. Foreign body aspiration. C. Infants require back blows and chest thrusts to dislodge the object. Bronchiolitis. A. Supportive care is the standard treatment since bronchiolitis is usually viral. 6. Scenario: a 2-year-old presents with sudden onset of choking and respiratory distress after playing with small beads. Clinical findings: persistent coughing, unilateral diminished breath sounds, wheezing on auscultation. Key actions: identify one potential condition. A. Foreign body aspiration. B. Croup. C. Bronchiolitis. Select 2 interventions. A. Encourage forceful coughing. B. Perform Heimlich maneuver. C. Administer racemic epinephrine. D. Prepare for bronchoscopy. Answer: Condition: A. Foreign body aspiration. Interventions: A. Encourage forceful coughing and D. Prepare for bronchoscopy. Rationale: Condition: A. Sudden choking with unilateral breath sounds is classic for foreign body aspiration. Interventions: A. D. Forceful coughing may dislodge the object in mild cases. For persistent obstruction, bronchoscopy is the definitive intervention. Racemic epinephrine. C. is for croup, not aspiration. The Heimlich maneuver. B. is inappropriate for children under 1 year. 7. A 7-month-old presents with wheezing, nasal flaring, and increased respiratory rate. The nurse suspects bronchiolitis. Which of the following findings supports this diagnosis? A. Stridor with drooling. B. Bilateral wheezing and crackles. C. Barking cough with inspiratory stridor. D. Unilateral diminished breath sounds. Answer: B. Rationale: bronchiolitis, often caused by RSV, respiratory syncytial virus, commonly presents with bilateral wheezing and crackles due to lower airway inflammation and mucus buildup. Stridor with drooling. A. suggests epiglottitis. Barking cough and stridor. C. indicates croup. Unilateral diminished breath sounds. D. suggests foreign body aspiration. Question 8. Which of the following interventions can help reduce RSV transmission in a hospital setting? A. Hand hygiene before and after patient contact. B. Isolating the patient in a private room. C. Administering palivizumab to all pediatric patients. D. Wearing gloves and gowns during patient care. E. Providing prophylactic antibiotics to close contacts. Answer: A, B, D. Rationale: hand hygiene. A. RSV is highly contagious, and proper hand hygiene is the most effective prevention method. Isolation. B. RSV patients should be in private rooms or cohort with others with RSV. Gloves and gowns. D. Contact precautions are essential to prevent the spread of RSV. Incorrect options. Palivizumab. C. This is for high-risk infants only, not all pediatric patients. Antibiotics. C. RSV is viral. Antibiotics are not preventive. Question 9. True or false RSV treatment? Bronchodilators are routinely used to treat RSV. Steroids are the mainstay of treatment for bronchiolitis caused by RSV. Supportive care, including oxygen and hydration, is the primary treatment for RSV. Answer: false, false, true. Rationale: bronchodilators. False. Routine bronchodilator use is not recommended unless the child has underlying asthma. Steroids. False. Corticosteroids are not standard treatment for RSV-related bronchiolitis. Supportive care. True. Oxygen therapy, hydration, and suctioning are the primary interventions. Question 10. Match the type of pneumonia with its associated clinical findings and management approach. Type: bacterial pneumonia. Viral pneumonia. Findings: gradual onset diffuse wheezing, sudden high fever, focal crackles. Treatment: A. Supportive care, oxygen, fluids. B. Antibiotics. Answer: bacterial pneumonia, sudden high fever, focal crackles. B. Antibiotics. Viral pneumonia, gradual onset, diffuse wheezing. A. Supportive care, oxygen, fluids. Rationale: bacterial pneumonia typically has an acute onset with localized findings, e.g., crackles in one lung. Antibiotics are required to treat the infection. Viral pneumonia presents more gradually and affects both lungs diffusely. Supportive care is the mainstay as antibiotics are ineffective. Question 11. Scenario: a 4-year-old is admitted with bacterial pneumonia. Prioritize the following interventions. Encourage oral fluids as tolerated. Monitor oxygen saturation continuously. Obtain a sputum culture. Administer prescribed antibiotics. Correct order: obtain a sputum culture. Administer prescribed antibiotics. Monitor oxygen saturation continuously. Encourage oral fluids as tolerated. Rationale: Step 1. A sputum culture must be obtained before starting antibiotics to ensure accurate identification of the organism. Step 2. Antibiotics are essential to treat the bacterial infection. Step 3. Monitoring oxygen saturation identifies hypoxia early, enabling prompt intervention. Step 4. Encouraging fluids prevents dehydration and helps loosen secretions. Question 12. Scenario: a 3-year-old suddenly begins choking while eating grapes. Clinical findings: coughing forcefully, wheezing on auscultation, increased respiratory effort. Key actions: identify the priority condition. A. Foreign body aspiration. B. Asthma exacerbation. C. Epiglottitis. Select 2 interventions. A. Encourage the child to continue coughing. B. Perform abdominal thrusts. C. Prepare for emergency bronchoscopy. D. Suction the airway. Answer: condition: A. Foreign body aspiration. Interventions: A. Encourage coughing. C. Prepare for bronchoscopy. Rationale: condition: A. Sudden choking with wheezing strongly suggests foreign body aspiration. Interventions: A. C. Forceful coughing may expel the object if the airway is partially obstructed. If unsuccessful, bronchoscopy is required to remove the object. Abdominal thrusts B are not recommended unless the airway is completely obstructed. Suctioning D is ineffective for large foreign bodies. Question 13. Which clinical finding during airway assessment indicates severe airway obstruction in a child? A. Subtle intercostal retractions with mild tachypnea. B. Audible stridor with nasal flaring. C. Inspiratory wheezing with a prolonged expiratory phase. D. Bilateral equal breath sounds with SpO2 of 96%. Answer B. Rationale: audible stridor and nasal flaring. B. These indicate significant upper airway obstruction, which is an emergency. Mild retractions and tachypnea, A. suggest mild respiratory distress, not severe obstruction. Wheezing and prolonged expiration, C. typically seen in lower airway conditions like asthma. Normal findings, D. Bilateral breath sounds and SpO2 of 96% are reassuring. Question 14. Which findings in a 2-year-old indicate severe respiratory distress? A. Grunting. B. Head bobbing. C. Cyanosis. D. Respiratory rate of 25 breaths/min. Tripod position. Answer A, B, C, E. Rationale: grunting A indicates difficulty maintaining oxygenation. Head bobbing B suggests severe fatigue and effort to breathe. Cyanosis C indicates inadequate oxygenation. Tripod position E reflects an effort to open the airway. Respiratory rate of 25 D normal for a toddler. Questions 15 to 20. Case scenario: a 2-year-old boy, Jackson, is brought to the emergency department by his parents. They report that he had a sudden onset of difficulty breathing after eating popcorn. Upon assessment, Jackson is alert but in moderate respiratory distress. His vital signs are as follows. Heart rate 130 bpm. Respiratory rate 40 breaths/min. Oxygen saturation 90% on room air. Temperature 37.2 degrees Celsius 99 degrees Fahrenheit. Clinical findings. Audible wheezing on auscultation. Substernal retractions. Unilateral diminished breath sounds on the right lung. Persistent coughing but unable to clear secretions. Question 15. Key task. Analyze the situation and identify the priority condition, 2 immediate interventions, and 1 complication to monitor for. Priority condition. Select 1. A. Foreign body aspiration. B. Asthma exacerbation. C. Bronchiolitis. D. Pneumonia. Immediate interventions. Select 2. A. Encourage continued coughing. B. Administer racemic epinephrine nebulizer. C. Prepare for rigid bronchoscopy. D. Perform back blows and chest thrusts. Complication to monitor for. Select 1. A. Complete airway obstruction. B. Mucus plug formation. C. Hypoglycemia. D. Pulmonary edema. Answer. A. Foreign body aspiration. A. Encourage continued coughing. C. Prepare for rigid bronchoscopy. A. Complete airway obstruction. Rationale. Priority condition. A. The sudden onset of respiratory distress and unilateral diminished breath sounds strongly suggest foreign body aspiration. Immediate interventions. A. C. Encouraging coughing can expel the foreign body if the airway is partially obstructed. Unsuccessful, rigid bronchoscopy is the definitive treatment. Back blows and chest thrusts. D. Are inappropriate since Jackson can still cough. Racemic epinephrine B is used for upper airway swelling, not aspiration. Complication. A. Complete airway obstruction is a life-threatening risk in foreign body aspiration. Question 16. Place the following nursing actions in the correct order for managing Jackson's condition. Administer oxygen via face mask. Prepare the child for rigid bronchoscopy. Perform a focused respiratory assessment. Notify the healthcare provider immediately. Correct order 3-1. 4-2. Perform a focused respiratory assessment. Administer oxygen via face mask. Notify the healthcare provider immediately. Prepare the child for rigid bronchoscopy. Rationale. Step 1. A focused respiratory assessment confirms the severity of distress and establishes a baseline. Step 2. Oxygen improves SpO2 and prevents further hypoxia. Step 3. Early provider notification ensures timely interventions. Step 4. Bronchoscopy is the definitive treatment and must be prepared promptly. Question 17. Match the following risk factors with their corresponding explanations for increased risk of foreign body aspiration. Risk factor explanation. Age 2 years. A. Increased chance of putting objects in the mouth. Popcorn consumption. B. High likelihood of aspiration due to small size. Lack of supervision. C. Poor chewing ability and immature airway reflexes. Answer. Age 2 years. Answer C. Popcorn consumption. Answer B. Lack of supervision. Answer A. Rationale. Age C. Toddlers are naturally curious and frequently place objects in their mouths. Popcorn. B. Small hard foods like popcorn can easily become lodged in a child's airway. Supervision. A. Toddlers have underdeveloped chewing and swallowing reflexes, making them prone to aspiration. Question 18. Which clinical finding in Jackson most strongly suggests a partial airway obstruction? A. Grunting with every breath. B. Persistent coughing and wheezing. C. Cyanosis of the lips and extremities. D. Stridor during inspiration. Answer B. Rationale. Partial airway obstruction. Persistent coughing and wheezing indicate that the airway is partially blocked and air is still moving. Incorrect options. Grunting A and cyanosis C suggest severe respiratory distress or hypoxia but not necessarily a partial obstruction. Stridor D indicates upper airway obstruction, which is not the case here. Question 19. Which nursing actions are appropriate for Jackson based on his current condition? A. Monitor oxygen saturation continuously. B. Keep Jackson calm and minimize agitation. C. Position Jackson flat on his back to rest. D. Suction nasal passages to remove mucus. E. Educate parents on the need for further diagnostic imaging. Answer A, B, E. Rationale. Monitor SpO2. A continuous monitoring ensures early detection of worsening hypoxia. Keep calm. B. Agitation increases respiratory effort and worsens obstruction. Educate parents. E. Imaging such as a chest X-ray or bronchoscopy may be needed to locate the foreign body. Incorrect options. Flat positioning C can worsen airway obstruction. Suctioning D does not help in cases of foreign body aspiration. Question 20. True or false? 1. Aspiration of a foreign body can lead to atelectasis or pneumonia if not promptly addressed. 2. Foreign body aspiration rarely causes long-term complications in children. 3. Bronchoscopy is the gold standard for diagnosis and treatment of foreign body aspiration. Answer 1 true, 2. False, 3 true. Rationale. True, atelectasis or pneumonia prolonged obstruction can collapse the lung, atelectasis, or lead to secondary infections. False, long-term complications, delayed treatment can result in permanent airway damage or chronic lung issues. True, bronchoscopy, rigid bronchoscopy is both diagnostic and therapeutic, making it the preferred approach. Question 21 to 25. Case scenario. A 5-year-old girl, Mia, is brought to the pediatric clinic with complaints of a persistent cough, nasal congestion, and a low-grade fever for 3 days. Her mother reports that Mia has been wheezing at home and has trouble sleeping due to the cough. Upon assessment, Mia is alert but appears tired. Her vital signs are temperature 38.1 degrees Celsius 100.6 degrees Fahrenheit, heart rate 115 BPM, respiratory rate 32 breaths/min, oxygen saturation 93% on room air. Clinical findings: wheezing and fine crackles on auscultation, intercostal retractions, mucus-filled nasal passages. Diagnosis: suspected viral bronchiolitis. Question 21. Priority condition. Select 1. A. Viral bronchiolitis. B. Asthma exacerbation. C. Bacterial pneumonia. D. Croup. Immediate interventions. Select 2. A. Suction nasal passages. B. Administer broad-spectrum antibiotics. C. Provide oxygen therapy to maintain SpO2 greater than or equal to 94%. D. Administer a short-acting beta-agonist inhaler. Complication to monitor for. Select 1. A. Dehydration. B. Complete airway obstruction. C. Sepsis. D. Pulmonary embolism. Answer: A. Viral bronchiolitis. A. Suction nasal passages. C. Provide oxygen therapy to maintain SpO2 more than or equal to 94%. A. Dehydration. Rationale. Priority condition. A. Symptoms such as wheezing, crackles, and low-grade fever are characteristic of viral bronchiolitis, often caused by RSV. Immediate interventions. A. C. Suctioning nasal passages removes mucus and improves airflow. Oxygen therapy maintains adequate oxygenation, critical in bronchiolitis. Antibiotics. B. Are not indicated for viral infections. Beta-agonists. D. Are not routinely recommended unless there is a coexisting condition like asthma. Complication. A. Dehydration is common in bronchiolitis due to reduced oral intake and increased insensible losses. Question 22. Arrange the following nursing interventions in the correct order for Mia's care. 1. Educate the mother about signs of respiratory distress. 2. Administer oxygen via nasal cannula. 3. Perform nasal suctioning. 4. Monitor for dehydration signs, e.g. decreased urine output. Correct order: 3, 2, 4, 1. Rationale. Step 1. Nasal suctioning helps clear mucus, improving Mia's oxygenation. Step 2. Oxygen therapy is provided if her SpO2 remains below 94% despite suctioning. Step 3. Monitoring for dehydration is vital, as poor intake is common with bronchiolitis. Step 4. Parental education ensures timely recognition of worsening symptoms at home. Question 23. True or false? 1. Nebulized hypertonic saline may be used in hospitalized children to improve airway clearance. 2. Corticosteroids are the first-line treatment for bronchiolitis. 3. Hydration and oxygen support are the cornerstone of bronchiolitis management. Answer: true, false, true. Rationale: hypertonic saline. True, studies show that nebulized hypertonic saline can help loosen mucus and improve airflow in hospitalized cases. Corticosteroids. False, corticosteroids are not effective for bronchiolitis and are not part of routine treatment. Hydration and oxygen. True, these remain the mainstays of supportive care in viral bronchiolitis. Question 24. Which of the following findings in MIA suggest worsening respiratory distress? A. Nasal flaring. B. Substernal and intercostal retractions. C. Grunting. D. SpO2 of 96% on room air. E. Decreased level of consciousness. Answer: A, B, C, E. Rationale: nasal flaring. A. Indicates increased effort to breathe. Tractions. B. Reflect the use of accessory muscles, a sign of respiratory distress. Grunting. C. Suggests severe effort to maintain oxygenation. Decreased level of consciousness. E. Indicates hypoxia or fatigue from respiratory distress. SpO2 of 96%. D. This is a normal oxygen level and not a sign of distress. Question 25. Mia's younger brother, age 3, has developed a barking cough, hoarseness, and stridor. He is afebrile and alert. The nurse suspects croup. What is the first intervention? A. Administer oral dexamethasone. B. Suction the airway to remove mucus. C. Administer racemic epinephrine nebulizer. D. Keep the child calm and avoid unnecessary handling. Answer: D. Rationale: first intervention. D. Keeping the child calm minimizes agitation, which can exacerbate upper airway obstruction in croup. Oral dexamethasone. A. Effective in reducing airway swelling but not the immediate priority. Racemic epinephrine. C. Used for severe cases but not first line for mild to moderate symptoms. Airway suctioning. B. Unnecessary and can cause distress in croup, as mucus is not the primary issue. Thanks for watching part 1 of my Pediatric Respiratory NCLEX-RN series. Don't forget to like, subscribe, and comment if you found this helpful. And stay tuned for part 2, Gastrointestinal Disorders, where we'll dive even deeper into high-yield NCLEX prep topics. See you in the next video. Keep studying and stay motivated.